Hi, welcome back to Rohrich Knows Podcast, helping you become a better and more informed you. Let's talk about rhinoplasty, one of my favorite topics. There's been a lot of buzz about preservation rhinoplasty. Is it better than precision rhinoplasty? And what is it? And is it really a preservation rhinoplasty? Well, I'm going to talk to you about my almost 3-year experience with using preservation rhinoplasty and how I incorporate it into precision rhinoplasty. So I call it the marriage. And the key with rhinoplasty is it's got to be reproducible. You got to be able to teach it. You have to have consistent results. And you have to know what your complication rates are. And you have to know the risks and the benefits. So both of these procedures are techniques. Precision is structural rhinoplasty. I've been doing it for over 30 years. And preservation rhinoplasty is not a new procedure, but it's one that's been reborn. It used to be the push-down, let-down procedure. Now it's called preservation. So let's dive deep into what this is. And the key is, if you don't remember the past, you're going to repeat it. And I think that's the important thing about preservation rhinoplasty, because it's not a new technique. But the common bind is you have to have consistency. As you can see here, you have to have consistent results if you're going to become good in precision rhinoplasty, in any rhinoplasty. So what is precision rhinoplasty compared to preservation? Well, you know, they're both techniques and they're used for specific things. And a preservation rhinoplasty just preserves this dorsal part right here, rather than taking it apart like you do with a structural or precision rhinoplasty. You can preserve that bony cartilaginous envelope. Now, there's a lot of different ways of doing it. There's a high, low septal strip and a lot of things in between. But are you really preserving a lot? I think a lot of times you may be destabilizing the septum, especially if it's weak. So I think it's a little bit of a misnomer, but it's an excellent technique in certain selected patients. So let's dive into that. I think that the other thing is there are risks and complications with any type of rhinoplasty, but the most common ones here are a recurrent hump, a step off, a saddle. I've seen all these things in patients that have been referred to me. So you got to be careful. You have to know before you go. And that's why with all technology, there's a zealot phase, and then there's the application and reality phase. So we are now beyond the zealot phase. We're more into the application and reality phase, where it is used not for everybody, but for certain selected areas. And the reality is, it's a technique. It's a really good technique. It's a really good refinement, and I think you should use it. And it's a refinement technique. So, but before you walk, you must crawl. And I think that's why you have to understand the principles of rhinoplasty first. So, when do I use it? I use precision rhinoplasty all the time, in any type of rhinoplasty, because I can open the nose, I can see structurally what's there to be fixed, the dorsum, the tip. But the key is, what are the long-term results? You know, you can restore the dorsal aesthetic lines, as you can see in this beautiful woman, up to 11 years post-op, and 10 years post-op. You can see her nose is straighter, better. It's beautiful. But in preservation rhinoplasty, you have to be careful in your patient selection. In my hands, it's really these main indications is, you shouldn't have a significant septal deviation, and you should have a strong septum with good width, because you're going to be weakening the septum. And you should have reasonably good perioperative dorsal aesthetic lines. And I think those are really the hallmarks, I think. And the avoidance of preservation should be done probably in secondary rhinoplasties if they have significant septal deviation, or if they're weak, or if they have a really bowed S-shaped bony dorsum, and they have a low radix, which means that this part of the nose is low. And you have to understand the blocking points, which are critical to prevent hump recurrence. That's the cornerstone. And obviously, it's beyond the scope of this podcast to talk about blocking points, but basically, these are the things that prevent you from getting a good result in preservation rhinoplasty. And there are 8 of them. And again, I will share those with you in another podcast, because that's the hallmark of preservation rhinoplasty. You have to understand the anatomy and understand how to do it. So let's dive in on staying safe and with preservation rhinoplasty. I think a very good way to do it is a high septal strip, you do it in a patient that's got a fairly straight nose, good dorsal aesthetic lines, a high radix, and you have a moderate dorsal hump. And this is such a patient. And this is a patient that's now, I'll show you her 2-year post-op. She had beautiful dorsal aesthetic lines. She's a little deviated, her tip's a little bulbous, she has a dorsal hump, but I think a good candidate for this procedure. Her skin is thin, so we did a high septal strip, we did osteotomies, we did structural tip shaping, and then here she is at 6 months post-op. You can see she still has some swelling. She's got nice dorsal aesthetic lines. They're straight. Her tip is nice. Her shape and contour is good. Here she is at 2 years. It looks even better. And she's maintained her result, and I think that looks good. 6 months, 2 years. 6 months, side view, 2 years. Even better. 6 months, 2 years. Again, looks great. Looks shape and contour is good. And I think that's the beauty of this, is that, you know, in a patient like this that has fairly good dorsal aesthetic lines, shape and contour is good, thin skin, it's ideal. It's ideal for this type of patient. So I think knowing before you go is very, very important. And I would say that when you see this patient, and here she is, post-op, and just shows in a recent Instagram where I actually saw her at 2 years, she is actually totally in love with the results. She's a beautiful woman. Her shape and contour is beautiful. You can see her dorsum is really perfect. Her radix is beautiful. Her tip shaping is great. She no longer has droopy tip. It's just magical. So in highly selected patients like this, she looks amazing. And the recovery is probably not dissimilar to precision rhinoplasty if you're facile at doing both. She actually had a fantastic early recovery, and I think that's one of the quote-unquote advantages of preservation rhinoplasty, but she's beautiful. And of course, you know, she was beautiful before. So in summary, I would say preservation rhinoplasty is an excellent refinement, a great technique in highly selective patients that have thin skin, good dorsal aesthetic lines, not totally deviated dorsum, and no significant posterior septal deviation. They have a strong septum and good septal width. I think these are excellent patients for a preservation rhinoplasty. So hopefully this was very helpful to you in understanding the difference between structural or precision rhinoplasty and preservation rhinoplasty in your journey to selecting which type of procedure you're going to have. But the most important thing is finding a board-certified plastic surgeon or facial plastic surgeon that is an expert in rhinoplasty is the key to getting a great result. Hopefully, this was very helpful to you, helping you become a better, more informed you. Please leave me your comments and thoughts. Until next time.